I'm on mute. Good morning. I must have muted myself. It's great to see folks this morning. Good morning, Rachel. Good morning, Jen. We'll give folks a minute to join. As folks are joining tomorrow, we'll have sharing the mic. So if folks have updates, announcements, events, anything you want to share with the 9:30 call community, will also be, it's our gratitude edition. So we'll be talking about gratitude as well. And so folks know we're so excited that, oh, Jen and Rachel, I called no small feat, little feat yesterday on the call, taking us back. Little feat appeared at Skidmore College. So I met them. But No Small Feat has been doing a series. So it's been great to have Jen and Rachel join us. We have, I think, 4 or 5 maybe calls already scheduled. So we're so excited to have this partnership. So if you've come in through the No Small Feat lane, welcome to the 9:30 call. We do this call 4 days a week, 9:30 to 10 a.m. We are booking for January, so if you know folks that would be a good guest, please let me know. But I'll turn things right over to Jen and Rachel.
Great. Thanks very much, Amy. Is it okay if I share my screen? Great. So today we are super excited to join you once again, and we're going to talk today about some of the work we are doing around family resource centers. So I'm going to share my screen here. Um, and let's see if I can make my screen move. Here we go. So as a reminder, No Small Feat is our name of our group that has been working together from really since early 2025 to think about response for children as it relates to children. It kind of came together around the threats from the federal government, and we're now sort of thinking about where we go from here. And the role of No Small Feat is really to convene, connect, and communicate. Convening partners across systems in Massachusetts that work with children, connecting the data, funding, and stories about that work, and communicating the impact and urgency around federal cuts, and really now, especially as we're seeing things tighten up at the state level, the ripple effect on children and families here in Massachusetts, and how do we respond to that as a group. So today we want to talk about the Family Resource Centers. This was something for those of you who participated in our June No Small Feat convening. The idea of family resource centers and a place where people can go for help, an easy access to get to for help, was a major theme that kind of came out as something that needed to be a priority for families in Massachusetts so that we are able to kind of have that easy access to services. So for folks who aren't familiar with the family resource centers, they are a community-based program that is operated by community providers funded by DCF. But this is a description from the website about family resource centers, and I actually really love this description because it kind of makes this sound like a wonderful, friendly place. And the FRCs really are that. They are a friendly, welcoming place for families to come to for help. And I'll talk a little bit more about the history and sort of what they were established to do, which was they were established in 2015 as part of what's called the Reform of the Child in Need of Assistance, or CHINS system, which is now called our CRA, or Child Requiring Assistance system. So they were really founded as part of a DCF kind of program, but they've really expanded in so many different ways. And you can see here some of the things that FRCs do that support families.
Well, I learned something on the 9:30 call today. I
Hey,
never
there you
knew
go.
what CHINS stood
Ah,
for. I
yeah,
knew what it
chins.
was. Thank you, Rachel.
There you go. So they've been part of this evolution of how do we think differently about serving families whose kids are struggling, mostly with school-based kind of behavioral issues, and sort of kind of growing from there. As you can imagine, during COVID, they really expanded where families were looking for help with all kinds of things, including basic supports, diapers, rental assistance, how do I connect to job assistance? So during COVID, that work really expanded. And you can kind of see here some fast facts about the FRCs. As I said, they were launched in 2015 with 18. There are now over 30 FRCs across the Commonwealth. I'll show you a map of them in just a moment. And the number of families that they've served has really increased year over year. This data is from the evaluation. So UMass has partnered with DCF to do an evaluation of the FRCs. And so there's lots of great data about who they serve, what kinds of services, why families come to the FRCs. A lot of what they come for is for support around education and school-based needs. So you can imagine, a student is having behavioral challenges or the family needs help with an IEP. That's a lot of the reasons that families get referred to the FRCs. So you can kind of see that work has really been growing, and especially in the last few years. So this is a map of where the FRCs are located. The red stars are where they're located, and the colored boxes are what zip codes each FRC serves. So you can see there's a pretty good range of where they are and who they're serving. There's also some big gaps. And of course, as you all know, can imagine, a lot of that's related to transportation and especially out in Western Mass, and sort of, also information gap about what is the FRC, who is it available to, what kinds of things can I get there? And of course, like, for folks who know, you don't always know that it's a DCF program, but folks might be a little bit worried about the stigma of, being in contact with DCF, for help when there's a threat of, potentially having your children taken away. So this is kind of gives you an idea of kind of where they are, who they're serving, and they're sort of typically located within the DCF area office, regional office locations, and also near the juvenile courts. There's another map that kind of shows their location in proximity to some of these other sort of DCF CRA oriented resources. This map is from the Office of the Child Advocate, also did a big report in 2024 about the FRCs. And this map is from that report, which is a long report, but has a lot of great information. If you really want to take a deep dive on the FRCs, that's a great place to go. So the opportunity ahead. So right now, DCF is working with a project management team to think about the redesign and reprocurement of the FRCs. So this reprocurement is going to take place sometime next year, or that's the plan. And what they're doing is we're really excited about this, taking a really deep dive and asking some basic questions about who comes to the FRC, how do they get there, how do we better serve these families, in terms of both child requiring assistance cases and then other types of services. And then who are the community providers that need to be, involved? What are the different relationships between the FRC and other state agencies, networks, services that are part of the conversation? So that's a lot of the work that's happening right now that Jen and I are both involved in, and we're really excited to bring some of the learning and knowledge from our group to and from communities like this to those conversations so that it feels like a really well-informed process. Um, and yeah, so I think I'm going to stop there. I can't see the chat at the moment, but I don't know if there are questions in the chat that I can answer.
We're taking care of it, Rachel.
Okay, great, perfect. Jen, anything else you want to add about the sort of what we're talking about with DCF right now in terms of the work at the FRCs?
Just a couple of things to try to make some connections. So one, I really want to I feel like DCF never gets props, and I really want to give DCF props for bringing in both Children's Trust to be at the table as they're redesigning the FRCs for this next chapter, and Rachel also. And so what that's really bringing in is some outside voices, some experiences and different ways of how to work with families. And so that's been really wonderful. And typically state agencies don't do that across the state. And so really grateful for that.
Yep.
What that's helping us be able to drive is really thinking also about how the family resource centers can become another resource for the work that we're going to talk about at the next 9:30 call, which is about reducing neglect. And how do we get it so that our mandated reporters across the Commonwealth are getting families to support mechanisms before reporting them for neglect to DCF. And the family resource centers are a critical component of that, Because if you're mandated reporter and you're busy doing your early education and you have a classroom full and so much going on, you may not have the knowledge, the time, the energy, the space to be able to do some of the deep resource needs that some families may have. But how great would it be that for you to partner and know that your local family resource center is a place that you can have families go to, and that could potentially be one of the first spots for them to go. And so we know um, the next chapter of the FRCs is critical for us as a Commonwealth. And so we're really excited of like all of these things are coming together. And so yeah, so I just wanted to make sure folks understood that
Yeah.
connection.
Yeah. And just to reiterate, one of the big themes we heard in our work with the No Small Feet group has been, and certainly you all see this, is, families, when you see a family that's struggling or a family is struggling, where can they go for help? Where can they go to get an idea of, well, how do I sign up for this state benefit? How do I look for this resource in my community? How do I get connected to the food bank or, whatever it is? So it's not just state agencies, but how do I get connected to other community-based resources in my community if I don't know those, or if I'm new here, or there's a language component that I'm trying to navigate. And the FRCs certainly play a role in that. There are many kinds of community navigators in different communities. In some communities, in some places there aren't. And
Right.
so, one thing we've been talking a lot about, not just with DCF, but with others, is sort of like, what are those helpline and help windows that families can walk through, help doors that families can walk through, to let me not mix up the metaphor too much, to find help in a non-threatening, non-stigmatized way,
Right.
and in a way that's culturally competent. And that's one thing that the FRCs do really well, is because they're community based, they're right in the community, they know all of the community partners. They have a lot of cultural competency when it comes to working with the population in their neighborhood.
There was if you could put the map up, we're a
Yeah,
statewide call. We have the
sure.
413, the
Yeah,
508, the 978, the
that's right.
781. And then Kate Warren Barnes also wondered in the chat, I'm curious how many of the regular 930 callers are familiar with FRCs.
Yeah,
Do you and or your staff ever refer families to them? So I want to highlight that. And if folks want to add that to the chat, because I'm sure that would be helpful information as you're thinking about reimagining.
that would be
So I
great.
think, and then somebody had asked a question like, if you live in a place that doesn't have a color, can you access
Yes.
services? And Jen wrote in the chat. And so, and then somebody wondered, is the closest to Boston in Somerville?
There's a couple in the Boston area. There's one in Dorchester, Mattapian. There is Somerville. There's, I would say that I think you put the link to the website, and that has a place where you could put in your address, and it will tell
Okay,
you sort of where the FRCs are.
great. And then Don Holly wondered, how do you think about the connection to the Coordinated Family Community Engagement Network, the
Yep.
CFCEs?
Those are exactly the questions we're talking about with DCF. What are the other coordinated service networks that need to be talking to each other as we think about streamlining all of these services across Massachusetts?
And then folks are responding to Kate's question. Ashley said, yes, I'm the owner director of a child care center on the Cape and frequently share information about local resources. I'm
Great.
sure there might be even geographical, differences about what might be available. As you said, we've been thinking about local work in terms of like kind of start anchored in preschool expansion, but then what does that look like? We know even in those systems, there's not a lot of consistency about who the partner might
Yeah.
be, where they might sit. Can you talk a little bit about that?
Yeah, that's absolutely right. Every community is very different. I know some of the FRCs, like Pittsfield, is super connected to every other thing happening in the Pittsfield area, and all of those type of services. And some of them, in big cities, there's a lot of different places where families go for help, and so there's different types of connections. And Don, I see your question about the ovals. I'll respond to that. So it really does depend a little bit on the community, but most of the FRCs have been in the community for, a number of years now, and they're pretty well connected around, who else is in the community, especially through the schools and the courts. So it might be a little bit different in different communities, but I think I'm seeing people put in the chat here, like, different ways that they're kind of like been introduced to that work, whether it's through food systems or healthy families or early intervention or all kinds of things that are kind of services for children. So the ovals on this map, part of the OCA's analysis around going into this reprocurement was to figure out where there is a high concentration of families being served from multiple zip codes. And so these are opportunities where there's a lot of work happening at that particular FRC. And so there's an opportunity to maybe expand it so that they can cover more territory.
Thank you for that. Lots of answers to Kate's question, which is great. And then can you say a little bit more about kind of this opportunity to reimagine or re-envision what kind of information would be most helpful during this process? Is
Yeah.
there a timeline?
Yeah, Jen, do you want to add anything at this point?
Well, I just wanted to respond to another chat, and then
And you can,
Rachel,
I'm
you
sorry,
can get
Rachel,
your
you
Yeah,
can
thoughts and
yeah.
take
respond
the map
Go
down.
ahead.
to Amy's question. But Donna had asked earlier around, or had just made a comment about how she had been on the website, and it looked like it was more focused on behavioral and parenting
Yeah.
support.
Yep.
And that, do you want to talk about that, Rachel, or do you want me to?
Yeah, go for it.
I'll make a quick point. So the original, the enabling statute for the family resource centers that was created 10 years ago was for, like what Rachel was saying earlier, was for these children in needs of services. And so it was meant to be for your older-ish kids, not the early years kids. As time has gone on, they've become really the community hub, the family, the resources place. And so they've been used, I think, differently than how they were originally imagined. And so here we are 10 years later, now that it's time to redo the procurement and think about it and design based on the reality of what the community has been saying that it needs and wants. And so the children requiring assistance is still a part of it, but it's not the sole purpose of it anymore. It is very much a component of it. But there's a much broader general population need. And so I think the state is recognizing like, okay, so how do we make sure we are able to do that in a responsible and effective way?
Yeah. And I'll add to goes to your question too, Amy. One of the things that I've been talking about with some of our folks is that by the time you're a child requiring assistance case and you're coming to the attention of DCF or the courts or the FRC, there's so much we could have done at a younger age, right, for in a preventative way. So that's a lot of the conversation we're having too, is like, how do we better connect families to more support and preventative types of resources, like when you're in elementary school or middle school, before the kid has like a massive behavioral health problem or a behavioral challenge that's now they're 16 and they're what the statute calls a stubborn child, and they're not listening to mom anymore, and they're 16 and they're like, I'm out of here anyway. So there's a lot we can do before we get to that point, and that's some of the conversation we're having as well, is like what role can the FRCs play in supporting families with younger children before we get to a place where you need more intensive intervention.
Right. Kathy shared, I think in my setting of early intervention programs, Part C of IDA, that providers would benefit from training more information on FRCs. I recently met someone at the Children's Trust Conference from the Worcester FRC, and we have an EI program in Worcester, but neither
Perfect.
agency was connected. We're heading there
Uh-huh.
in January to reintroduce EI to their staff. There's
That's
lots of
what we want.
celebration about
That's
that.
great. Yeah, I mean, that's what we need more of, is just more of these community connections. So programs are more aware of each other, so
Right.
that it's easier to make that warm handoff to families. That's a lot of what we're talking about as well, is like, what are the warm handoffs that we need to make for families so that it's not a sheet of paper that says, here's a list of providers you can go get to, but let me connect you to the next service.
And I think like as we it's so exciting to hear about this on the 9:30 call because we talk about like we can be ambassadors of information and connection,
Exactly.
that Kim wondered what role can FRCs play early? So you talked a little bit about maybe the original attention, but
Yeah.
now what are you thinking about?
Yeah, I mean, like I said, like I think during COVID and during some community level emergency responses, like think about like the Lawrence gas explosion or, influxes of migrant families into certain communities, the FRCs kind of became part of this emergency response, one-stop shop. Like, let me just go here for help because somebody told me that this is a program in my community where I can get help. So I think there's this um conversation to be had about what role the FRCs play as either a place to get an immediate basic service, whether that's like they have a diaper pantry and you can go get some diapers today, or a warm handoff, like I said, to another more appropriate kind of basic support service. Like let me get you to the food bank, which is down the street, and let me like make sure you have all the information about how to get there. And here's a grocery card to send you on your way with. To here's a referral. They also do clinical assessment, right? So here's a clinical referral that we're going to do with you. We're going to spend some time with you to do a clinical assessment and make a clinical referral to whether it's a CBHC or to another mental health provider or whatever that need is from a clinical perspective. So it's a little bit of everything, and that's what we're really trying to narrow down is kind of like what are those buckets of services that the FRCs are able to provide to community members, knowing that every community is a little bit different in terms of what resources are available and how families kind of get referred between community services.
Justin shared, thank you for this important work and listening tour. We conducted a survey in our community and some focus groups last year. We heard parents want a place where they can connect with each other as well as receive
Yeah.
resources and a place where they can give back as
You
well as
know,
receive support.
I really love that. And that came up in a conversation I had yesterday is like some of our FRCs have been piloting these like literal parent support, peer support groups. Like, let's just have a place where parents can come talk to each other. Like, this is what I'm struggling with. Is anybody else struggling with that? And how can we work on that? Like, one of the topics that was mentioned was like help dealing with kids and their social media use, right? So like, how are you restricting your kids' phone use? What are you doing with social media? Like, how are we dealing with this? So I think the FRCs are absolutely a place where we can tap into family leadership and also as peer supports. And then also we've talked a lot about the professionals who have lived experience and want to kind of bring that experience
Mhm.
to life in supporting other families. So that's absolutely a priority for how we think about the staffing of these programs, so that there's a clinical component, but there's also really this peer support. This feels like a place where people get me and understand my needs and like
Right.
and we can have an informal conversation about that. That doesn't need a whole clinical plan and
Right.
referral and insurance and all of those things.
Isn't that what we all want, right?
I
To
mean,
find our
right?
people.
That's what this is, right?
That is. Donna shared providers in Western Mass used to live and breathe in the big red book of resources. I don't think providers feel like they have access to something that's so comprehensive as that used to be.
Yeah. Yeah, exactly. I think that's what different communities have that better or in better in some places, and so I think we want to see what the FRCs can be, how they can be a part of that community building.
And Donna
And I
said
just
families are missing community, and Kathy said, I think community providers are also missing community and connection.
Yeah,
Sorry, Jess.
definitely.
one of the things, just to add on that big red book idea, Donna, Donna, you're like a wealth of knowledge. You need to be in some more of the meetings that I'm in. Is so old school social worker, it was like the filing drawer of copies of faxes. Once upon a time, if you're really young, you may not even know what a fax is. But those were our resource papers, right? And then we would photocopy them and give them to our families. Those days are over-ish sometimes, and we also, I think there's also a recognition that we've got to figure out better around our resource coordination and information. And so, whatever that technology needs to be, that is also another effort that is happening in the state. It will be at the Reducing Neglect conference at their meeting that's happening in a few weeks, and there will be some working groups going on. And so, just definitely knowing that the big red book is missing for many.
So let me share one more slide. This is sort of our upcoming topics that Jen and I will be back on the 9:30 call to talk about a little bit more about the Reducing Neglect Project and what's happening with sort of child welfare legislation and technology. So we've got those topics coming up. And this is a little bit about where our No Small Feet group is headed. We're talking now about messaging around what does it look like to protect children from a state, especially at the state budget. Conversation is unfolding and gathering stories of like how families are impacted and how providers are trying to help fill some of those gaps with families and what we need to do from a state level. And then, we've talked about where we go from here as a group. We did a convening last year. We're thinking about doing another convening next year, maybe expanding that to more of New England. political candidates forum, so we can talk about what are the priorities for kids and try to get people on the record about that. And then we're, continuing to gather more ideas about where this group goes from here. So super excited to continue to be connected with this group here and how we can bring all of your expertise into our work.
So I added, we send a weekly email with our guests for the week for the 9:30 call. So if you're not on that list, please join that. It's the same Zoom link. We used to change the Zoom link every week, which was bananas. Back in the day of COVID bombing, Zoom bombing.
Right.
Natalia wonders, how can we get started and include information about in our own programs about a good way to get in touch with you and the kind of resources we're sharing? So how can people maybe share information about FRCs in their own programs?
Yeah. We think, Jen, do we still have a sign up link on the No Small Feet site?
Yes, let me put that link back in
Okay,
there
great.
so you can get the
Great.
information. And then also, I'm going to put also the link in here. I know it's hard for folks in early ed because you're at a center, you're caring for so many people. And so it's like day conferences are not an easy thing to do. But we are going to have the reducing neglect, which is really about the operationalizing what's needed for family support across the Commonwealth. And so I'm going to put that link in here too. If anybody's available on December 11th and that looks of interest to you, then feel free to join that effort too.
And I'm
That's
gonna put
great. Well, we have thank you for all this. I'll be back for future calls. So that's great
Good.
to see.
great.
Yay.
And then I'll
Um,
put the link in
and
the
just
chat
kind
here
of
for finding your local FRC. I know Mudge, you said you would do that. Definitely reach out to them, make a connection. That's the best place to make that connection is at the local level.
well, we appreciate you both for joining us and everybody behind you, kind of at the working on No Small Feet, and just really excited for this partnership and this opportunity to highlight the work on the 9:30 call. So also please spread the word, invite others to join. Everybody is welcome on the 9:30 call. We also have the 9:30 call in Espanol twice a month, which is a all Spanish call hosted by Harold Impala and Neri Garcia, our director of communications. So I think Jen and Rachel, there are also opportunities to think about booking someone who speaks Spanish on that call. We would love to talk about that.
Yeah, Harold and Paul are already on it.
Great.
Working on it. Yeah.
All right. Well, so we will be back tomorrow for sharing the mic. Keep on trucking during this short week, and we'll see you tomorrow. Have a great day. Thanks so much.
Great.
Thank
Thanks for
you.
having us.